To review a little bit from the last module, we talked about the advantages, particularly when we are observing something that takes place naturally or naturalistically. We talked about the advantages of a two-group and two multiple time point, at least 2 time points, for observing the effect of some kind of experience like an adverse childhood experience. We ended up talking about trying to extend that methodology to start to think about the effects of treatments or intervention programs. Here we're using the concrete example of the effect of a treatment program on something like mental health. We could be talking about almost any outcome. So we ended up talking about using this two-group, 2-time point research design to talk about studying the effects of treatments or interventions. In that last slide, we talked about assignment. We talked about an investigator assigning that treatment. We talked about an investigator assigning that treatment so that some individuals would receive the treatment, some individuals would not receive the treatment, and then we would observe the outcome in terms of mental health for those who did not receive the treatment. We would observe the outcome in terms of mental health for those who did receive the treatment. In that presentation or that conversation, we did talk that we worry about whether there is equivalence between the two groups at the outset. Is there some way that they differ that we don't know about in terms of their family history, their family background, the kinds of neighborhoods or communities that they live in? We worry that those pre-existing differences might have an effect on the outcome of interest. To that end, we start to think about a random assignment mechanism. That's what the red R stands for. The simplest and most common method of random assignment is that we flip a coin, and the coin toss determines whether individuals participate in the treatment or whether individuals don't participate in the treatment, whether they participate in the usual level of care. This random assignment has the advantage of allowing us to make much stronger inferences about the effect of the treatment, much stronger inferences about the causal dynamics potentially at play. There are sometimes some ethical concerns about using randomization, conducting what we would call an RCT or a randomized clinical trial. We worry about randomly giving a treatment to some individuals and randomly denying perhaps a treatment to other individuals. I want to discuss how warranted are these ethical concerns. If a particular treatment is a treatment that we already know to be effective, then it's a treatment that we probably shouldn't be studying. So if we know that a treatment is effective, we probably should not be studying it using an RCT design. So as we discussed in the first module, some treatments are helpful, other treatments have no effect or neutral effects, which means that in a sense, in essence, they are wasting the valuable time and energy of our clients, those we claim to serve. And other treatments, in fact, have proven to be harmful. We talked in the first module about group treatments for antisocial behavior, which are treatments that turned out to be harmful. So in many cases, we don't actually know whether treatments are effective or not. We only study a treatment when we have good theoretical or conceptual or clinical reasons to believe that the treatment would be helpful, but we still don't know whether that treatment is going to help or not. In these cases, random assignment still makes sense because we want to observe two groups that are equivalent at the outset of the study. One group gets the treatment, we observe how they're doing at the end of the study, the other group does not get the treatment. We're going to move a little bit from the experimental approaches to what we call review approaches. So we're going to talk here about what we call a systematic review. And a systematic review is trying to aggregate a number of studies. What we realize when studying something like a group treatment, or studying something that occurs naturalistically, like adverse childhood experiences, is there are not just 1 or 2 key studies. There may be 10 or 15 important studies. There may be 30, 50, hundreds, or even thousands of studies on a particular phenomenon or a particular treatment that we're interested in. A systematic review is an attempt to aggregate all of the relevant studies. So the basic idea of a systematic review is we're looking across studies. Some of those studies may be randomized trials. Some of those studies may be quasi-random experiments with assignment. Some of those studies may be studies of phenomena naturally occurring in the world. What a systematic review does is it looks across all of those studies, whether it's hundreds or even thousands of studies, and comes to a conclusion about what does the literature say overall. As consumers of the research or readers of the research, these kinds of systematic reviews can be exceptionally helpful in understanding what does the evidence base say for effective evidence-based practice. A meta-analysis is very similar to a systematic review. The way that a meta-analysis also aggregates or attempts to come to a conclusion about what 10 or 50 or 100 studies say. The way that a meta-analysis differs from a systematic review is that in a meta-analysis, we're actually calculating an average. So we're actually mathematically or statistically summarizing across the studies. In a systematic review, we have a qualitative assessment of what does the literature say. In a meta-analysis, we have actually a mathematical or a quantitative summary of what does the literature say. Again, these kinds of meta-analytic reviews can be exceptionally helpful to a practitioner or a consumer of the research, those of us who want to know what does the literature say overall about a particular social problem or a particular treatment. I want to close with a practical example. This is a meta-analytic review that I did with my colleague Elizabeth Gershoff at the University of Texas. This is a review of 50 years of research on physical punishment, the effects of physical punishment on children. In this sub-study, we're looking at the particular effects of physical punishment on child externalizing behavior. So this is behaviors where children are aggressive towards other children. The red dots indicate the strength of the conclusion of each individual study, the size of the effect that each individual study found. And in each case, each of these studies found that use of physical punishment increased the amount of child externalizing behavior. The green bars are an indicator of the confidence or the precision of that conclusion. And what this kind of analysis of the literature indicates, what this kind of analysis indicates is that over time, we find that the green bars are narrowing. We find that not only do our estimates converge, but we have more and more confidence in the precision of our results. In this case, a conclusion that use of physical punishment increases children's externalizing behavior.